You want this one?
Good morning. Welcome to meeting number 1 of the House Budget Review Subcommittee on Health and Family Services. The meeting materials were put online earlier this week and made available for downloading. At this time, we'll have the Secretary call the roll.
Representative Bowling.
Here.
Representative Fleming. Representative Raymond. Representative Wilner.
Here.
She's here.
Representative Moser. Chair Bentley.
Here. Okay. So now, this morning, we're going to have a presentation for Renee. And she's a speech pathologist and CEO of Associates in Pediatric Therapies. She is here to discuss Medicaid reimbursements for pediatric therapeutic services. SAGERCER, right? SAGERCER. Yeah. Ms. SAGERCER, please identify yourself for the record. And members, hold your questions till after the presentation, please. Thank you.
All right, can you hear me now? Thank you. My name is Angela Renee SAGERCER, and I'm a speech-language pathologist and the owner of Associates in Pediatric Therapy. I want to say first, thank you for allowing me to be here today to testify about something that is so dear to my heart, which is children's services and pediatric therapy. Also want to say a big thank you to my family that's here today supporting me, as well as several of our patients and employees that are sitting behind me. So I'm going to get started by telling you guys a little story. And it's about a mother's intuition. A mother's intuition is usually right. And this mother, she was actually a pediatric nurse herself, and she saw at an early age that her child needed early intervention services. But the issue was there wasn't a lot of services in that area. So this mother had to drive over an hour each way to get her child the services that she needed. She would do this for some time until her child then went to school and then eventually graduated from speech therapy services around 5th grade. A few years later, this mother was in a tragic accident, and her daughter at the time was a senior in high school. And she found herself at that time, the daughter, becoming the mother's caregiver, and took the mother to therapy, occupational, physical, and speech. It was at this time that daughter determined that she wanted to be a therapist and help change lives daily. I'm not sure if you know, but that story is my story. We all have a story here today, and I'm so excited to be telling you my story of why I'm so passionate about early intervention care for our children, because I am a success story. If I didn't have early intervention services, I might not be sitting here before you today. This was in the 80s, and my mother had to drive over an hour to get services because we lived in a rural town. We shouldn't have our kids 40 years later still struggling with the same services, yet we do. How can we fix that? Our Commonwealth needs us. I'm sharing you my story because it's important to me. As you can see, I have several kids myself. I have 5 kids. 3 out of the 5 have also received early intervention services and have success stories of their own. It is important that we focus on our kids, and it will pay in return. Oh, sorry. Oh, uh-oh. What happened? Something happened. Sorry. Okay. So as I'm talking about this, with our story, APT opened in 2007. And our purpose is to help as many children as we can help. And 5 years ago, we set our 10-year mission of being named, working really hard to provide services for any child who needs us wherever they may be. So we've continued to grow over those few years to provide this service for our kids. And in 2007, when we started, one of the reasons I'm here today is to talk to you about, we haven't actually seen, thank you, I just pushed enter right here.
I think you can just click the button or any button.
Okay, perfect. So our goal is to help, again, as many children as we can. And this year was our 5th year into this 10-year mission. And last year we were able to see over 300,000 visits. And we're going to talk about how we're going to help meet our target. And we're going to be able to help touch Western and Eastern Kentucky on top of just the other areas that we're at. So APT started in a little rural area in Taylorsville, and it started in early intervention. I met my husband at college. We moved back to his hometown, and I wanted to be a mother and a therapist at the same time. First Steps has been a big passion in my life since we started in 2007. Since then, we've grown organically as a company, meaning I cannot stand having a waiting list for a child to receive services. So as soon as that happens, that's how we've grown and spread. Just until recently, I'm from Tennessee, originally West Tennessee, and went to Murray State where I met my husband. We grew organically up until recently, and I brought on a partner to help us grow in Tennessee, which is also where I'm from. The services we provide are speech therapy, occupational therapy, physical therapy, behavior therapy, and audiology. Over the past 5 years, we've been named Best Places to Work in Kentucky, and I don't take this award lightly. It shows that we have quality therapists who love coming to work every day and providing the services for the children of the Commonwealth. We work hard to build our culture, but I'm going to talk to you today because I'm really afraid that we're losing ground. Currently, these are the counties that APT serves, and I hope that you see that our goal is to turn this map green, okay? We want to help as many children as we can, and I've talked to a few of you about how can we increase. You can see that we're in Western Kentucky as far southwest as we can go in Fulton, and we're providing teletherapy services in the school for children there based on some of the incentives that the legislation put in for telehealth, so thank you. And, we also go far north and south in Kentucky. We were in Eastern Kentucky as a family last week, and I know I've talked to Representative Bentley. There is a huge need there, and we want to be there to help. But if we cannot make some changes into our funding population here for the Medicaid therapy services, we're not going to be able to make some of those grounds that we want to make with the kids. So here's a snapshot of APT. Currently, we see over 5,000 patients a week. We are in a variety of settings. So we have clinics that patients come to us. We also have community partners such as the Kids Club, which is a pediatric daycare for kids with special needs, Down Syndrome of Louisville, a variety of preschools and daycares. We also do a lot of public schools in the state of Kentucky as well as private schools such as Christian Academy or in some of the Archdiocese schools. 60% of our population right now, excluding schools, has some form of Medicaid. And we have this is the number I want you to look at, guys, 2,500 children waiting for APT services, not statewide. This is APT services in the state of Kentucky. They're waiting for services at our office. Can you imagine how many more children are waiting across all the other agencies? Since 2007, we have had little to no increase in our budget. What has happened? So when APT first started, we were heavy First Steps early intervention, but then we also had a heavy commercial. Over time, with expanded Medicaid, and we're all familiar with expanded Medicaid, our population has grown and it has changed. Therefore, our demographics have changed. We are now 60+% Medicaid, where before I was a higher percentage for commercial insurance. I've never turned a child away based on the type of revenue source they bring to us. I've never told a child that they cannot come to our office because they have Medicaid. To me, I want to help every child. It doesn't matter their funding. But the thing that's happened is where we were able to support a lot of the Medicaid funding because we had a lot more commercial. Since expanded Medicaid, now we're heavier Medicaid, and that is a concern for us. So I want to tell you a story about my numbers here. The people cost and revenue, as you can see, from Q1 of 21 to Q4 22 has drastically continued to increase. There's a lot of variables and factors here, but the same with our operating increases in revenue. We know that inflation is happening across the board. Everybody's wanting increases in salary to keep up with putting food on their table at home. At the same time, our operating profit of revenue has decreased. Now, it varies. Like Q1 2021, it looks like I made a lot of money, but it was because Passport waited for almost the beginning of Q1 to pay me for a year of service the year before. So those variables happen a lot in the MCO world. But I want you to note that it continues to go down. And in Q2, because we were increasing our rates for our employees so that they could continue to provide food for their families, our profit margins were little to none. And in the Q4, we lost money. If we continue like this, we will not be able to continue to cover our cost as a company. So I want to share with you how $1 is spent at APT. 49% goes to our therapist salary and wages. 5% goes to admin benefits, 29% to admin support, 6% for rent, 4 cents for EMR, which is our medical records, 3 cents to treatment materials and other supplies. And then our goal is to have 3% operating profit to support future growth so we can continue to open offices and areas and our initiatives of what we want to help children in the Commonwealth do. So from 2021, our admin and benefits cost increased from 78 cents to 84. I want to talk about part of that is with the inflation and trying to just to retain employees, because what's happened is you can go to Chick-fil-A or Amazon or anywhere like that and make more money than you do helping build healthcare. It breaks our heart that we're not able to allow and pay some of our salaries that we want to pay for our staff. Not to mention, in Kentucky, I told you I do Tennessee and Indiana, and I'm sure you'll ask me some questions about those. The MCO burden of administration is totally different than the other states. And I have to have twice the manpower to oversee our billing department for the MCOs. And therefore, my admin cost is very high, as you can see. But it's because of the amount it takes to handle some of the MCO carriers that we work with daily. The other thing I want to talk to you about, you saw that was Best Places to Work for 5 years. Over the last few years, we've always been below average. Healthcare is usually 20% on average nationwide. We've always been below that. In 2022, our retention and turnover grew to 26%. And when we asked employees why they were leaving us, it's not because they didn't love their job at APT or want to continue to help kids, but it was because we weren't able to keep up with the competitive wages of what's going on in our society today. Our pay is not comparable to other settings for therapy, and I'll show you that graph in just a minute. They're leaving the field altogether. We've heard healthcare is leaving in drones. They're changing to another population like adults because they can make more money in the adult setting. APT is not able to keep up with inflation rates, or we do have a few that just want to stay home with their kids, and that is a small percentage. I recently had a therapist leave to go be a wine taster. I said maybe I want to do that too some days. So, it is what it is. I want to show here, this is the American Speech and Hearing Association. It's our national report for salaries based on 2021. APT, and this $65,000 is on the high end for us, for our therapist. We're on the lowest end here to provide quality care. We compare to a school, yet our therapists don't get 8 weeks off a year. So I want you to see this because it's an eye-opening a thing. Because prior, when we started, again, our rates were the same as they have been since 2007. We were able to be a trend, and we were able to pay competitive wages. But since 15 years, we haven't had an increase. We're not competitive anymore. We're losing providers. Okay, so here's the numbers. 2007, $89 for a per steps visit. 2023, $89. EPSDT, $85.05. 2023, $85.05. Our Medicaid rates, which are Medicaid fee schedule, have not changed significantly, plus or minus, since 2007. 2015, we saw a decrease. Every year I've gave my employees increases because if I don't, they're not going to stay. But yet APT has not had an increase. We have to pay for mileage, travel time, training, all of that. EPSDT, we're in the community. We're paying for mileage and travel. I also have some concerns with First Steps, which is our state's early intervention program. These numbers should be eye-opening to every one of you in this room. If you notice, in 2021, we had more children eligible for services and more referrals than the year prior, yet we actually served less patients. We only served 4,975 in our state early intervention program. Remember, I said at my office, we see 5,000 children a week. How is one agency seeing more than the state? And our waiting list is 2,500 kids at just our office. This number should be double for our state, and I'm really concerned about our First Steps program. Why is the First Steps program losing so many providers? Well, one is the burden that we are putting on it with the coaching model. I really think that we should look at the validity of the coaching model. And two, we have not had a pay increase in almost 20 years. This is not my company, but this is actual true data from the Therapy Advisory Committee that reports to the Medicaid Advisory Committee. This is a company in the state of Kentucky that in 2016 had almost 70 First Steps providers. In 2022, has a little over 20. Next slide is a picture of APT also. This is our company. We had over 70 providers in 2018, and to date, we have less than 15. Again, I told you that's how our company started, was early intervention. It's my passion. It's my success story. I want it to be other children's success story. And I think this number is telling that we have to make a change in the state, or we're going to continue to lose providers. Why are we losing providers? And this is just data. I'm not going to go into pictures for time or information for time, but it shows that where we have a lot of providers who are on the matrix, very few actually provide therapy. So for example, I have 15 providers at our company, and we only see 9 patients a week for First Steps. We are 1% of our company as a First Step service. It should be a larger percentage. But it's because of the headache and the burden that we're bearing with this new coaching model too. We're losing providers because other states are paying more. Indiana used to pay less than Kentucky, and this year in 2022, they just increased their rate to $135 a visit. They were in the lower 80s. Again, Kentucky was ahead of them, and now Indiana recognized the need for that. So what's happening is we have therapists in Louisville who are leaving Louisville to go get their Indiana license to drive across the border because they're making a lot more money. So our Kentucky families are losing good providers here. It's also happening in West Virginia. West Virginia is paying more. We have providers in Eastern Kentucky who are growing across the state line. I think that we can help our state by increasing the rate so that we keep the providers in the state that they live. Over the past few years, I've been an advocate. I'm on the American Speech and Hearing Association board as the Kentucky Star, and so I advocate for reimbursement. I'm also on the Kentucky Speech and Hearing Association board. I've been appointed to the Therapy Advisory Committee that reports to the Medicaid Advisory Committee. I've recently joined a rate study group that, those are fun because they take a few years to go through, and then, it's another few years before anything happens. So I'm doing everything I can. I provide input to our Kentucky Physical Therapy Association as well as the Kentucky Occupational Therapy Association. I've enjoyed meeting with several of you in your office as well as the Department of Medicaid and First Steps. This is not just an APT problem. I'm just the voice of our Commonwealth to tell you today that this is a statewide problem. Every provider is in the same boat. This is important because, again, we have over 2,500 children just at our office alone at APT waiting for services. That breaks my heart because I started and I grew organically because I never wanted a waiting list. And our waiting list continues to grow daily. Other states are realizing the importance of making changes for Medicaid and increasing the rates proactively. Arkansas increased 30%. Florida's done an increase. Michigan was similar, and well as Indiana just recently. These are just to name a few. We know that the return of investment, if you provide services early for these children, you're going to have a higher return on your investment than if you wait till they're even in school age. This right here, again, eye-opening. Kentucky is the lowest on here. I said that except Hawaii was really low too, but Kentucky is 0.30. 0.30. National average is 1.14. We're at 1.30, helping the children who need the services. I think we can do better. I know we can do better. I know we want to do better. We have to take action. The Medicaid fee schedule, as an association, OTPT and speech, we are asking that you look at the Medicaid top 5 CPT codes. We realize we might not be able to do every CPT code, but we're asking that you look at the top 5 CPT codes and give a minimum of a 20% increase and the evaluation codes. So not every code, every CPT, but the top 5 that we use daily. EPSDT, which is where we go into the communities, they come to our clinics, we're asking for a 20% minimum increase. from the 8505 that we've been paid since it started. First steps, we're asking for a 20% increase since it's been paid the same rate for almost 20 years. This still would not take us to the Indiana rate level. That is almost like a 30 to 40%. But we recognize that if we can do something, it will help keep some of the providers here before it's too late. MCOs, we need to increase their accountability. I'm not able to increase their accountability, but your story, you've been put in this position and you're able to increase that accountability. We're asking you to hold them accountable. We would love to see an annual percentage increase for providers. You're giving them billions of dollars. We're asking that they take care of the providers. And so several states already do this. It's already in several legislations that if they provide an increase in there every year that's tied to a CPT code. We're also wanting you to look at some provisions that are not necessarily protecting us. There are a number of other issues such as clawbacks, recruitment, et cetera, but we're not going to recruitment with our funds, et cetera, but we're not going to go into that. So again, our solution is a 20% increase for OTPT speech, for Medicaid fee schedule, the EPSDT, and for SEPs. Over time, these are going to be a cost savings to the state. I can guarantee you. You're going to have more success stories just like mine that are going to get up here and be CEOs of large corporations one day, and they're going to be able to tell their story. We want children to be successful adults. Prior to expanding any more Medicaid services in the population, we know like there's some expansion going on. We're asking prior to new programs that you take care of the current providers who have been providing the service for you for the past 15 plus years. You know, we're not saying that these programs aren't needed, but we're asking that you help take care of us as well. Since 2007, APT has helped over 30,000 children in the state of Kentucky. Early intervention and pediatric therapy can help children succeed and be successful in their daily lives. Thank you for your time today.
Thank you for your presentation. Are there any questions from the members? Representative Bowling.
Thank you, Chairman Bentley. Real quick, and I know you mentioned it just a little bit in the end there, and that was a great presentation, by the way.
Thank you.
A lot of information. I can tell you put a lot of time into that, and that gave us a clear picture of what the problem is and how we need to address it. Obviously, the rate increase is one part of that, but then also, and you just touched on it on the end, the MCO. You kind of you have other ideas. For me, like the rate increase without putting guardrails on the MCOs, it's kind of, you can't have one without the other, in my opinion. And so I would like to hear more from you on that, what your ideas are, how to put guardrails on the MCOs, just to make sure that, hey, we're going to increase it 20%, but MCOs are all of a sudden clawing back more and more and more and more. And then you're not getting the dollars at the end of the day, which is what we would want to do. So I don't know if you can get that information to myself or Chairman Bentley in the future, but that would be really good information to have.
I will definitely put some things together there. I think just also if there's any kind of legislation that we can put in there with some terminology for them. You know, they say that they're going to always send you an orange envelope, and you don't always get that orange envelope. There are so many things that I think we could get together as a group, and our associations would love to have this conversation. Our occupational therapy, physical therapy, and speech therapy associations of the state can put together a white paper for you and give you that as well, probably within the next week or two.
Okay, that'd be great.
Okay.
Thank you very much.
Representative Wilner.
Thank you, Mr. Chairman. That was a great presentation. Thank you so much. And, you know, I think there'll be a lot of bipartisan support for making sure that the MCOs are taking care of the providers. I know their focus is on improving population health, but you can't do that without the providers. And this is such an urgent message that we're hearing from you, and the loss of providers, not only in these early childhood interventions, but really across the board. Right. And I would be so interested in seeing some specific legislative proposals that we might be able to work on with you in a bipartisan way. And I think there's just general agreement on this issue that we need to support you guys a lot better than we are currently.
Thank you.
Thank you.
Thank you, Mr. Chairman. And hi, Renee.
Hi, it's good to see
I'm
you.
so sorry that I walked in so late, but I'm so familiar with your story and your situation. So I have no doubt that you did an amazing job of explaining this to everyone. And I just, want to just relay my support. I have had conversations with the cabinet, especially about the First Steps issue. And so have you had any conversations with the cabinet about?
We met with the cabinet on the 30th last week and talked to them, and they are also aware that I'm talking to you guys today.
Yeah.
We have a lot of work to do there, because the issue is we're losing providers because of payment, and if you add more work to their caseload, why would they want to do that service if it's easier to provide it somewhere else? And so we have to decrease the burden, across all providers. Like, how can we decrease paperwork? How can we decrease, that's my goal this year, but how can we decrease this? And the training and the coaching program is so intense that it's causing providers not to even want to join.
The First Steps.
Yes.
Yeah.
So.
Okay. Yeah.
So we talked to them, and they're listening now. I think that they're seeing that these numbers, like I shared today, they're eye-opening. Again, the state served 4,900 patients last year, and our office sees 5,000 a week. And so if that's not eye-opening, then I don't know what is. And we have over 2,500 children. And when you were in our facility, you saw children that should be in the First Steps program coming into our clinic.
Yep.
They're coming into our clinic because there is not enough providers providing early intervention services.
Right.
Yep.
Okay. Well, happy to work with you.
Yes. Thank you.
You're welcome.
Any other questions from the committee? Renee, I have a question. Explain the coaching program more to us.
So the coaching program is where you go into the home, and it is a different model. So you're coaching the parent. You're not supposed to necessarily take in toys. Hands-on therapy is, it's more of a coaching the parent to be the therapist and giving the parent strategies, which we agree that coaching can be good, right? As parents, we all need some coaching and education, but that's not the whole model. We believe that the whole model should encompass more than just coaching. I do think that that's a big piece of it. While other states also do coaching, the training is nothing like what Kentucky has put on it. Kentucky has spent quite a you can do the research. There's some grants that U of L is working on. U of L received this grant, and they, the state's provided a few millions of dollars to this coaching training, and it's an investment. And I'm sure that the intentions are good, but I think it's went a little too far. So where I think coaching can be beneficial to the families, I don't think that's the whole picture. As a therapist, there's other things that we can do to help the child. And if you're not supposed to bring in those activities and work with the kids hands-on, sometimes they just need hands-on, especially if you're teaching a child how to walk. The therapist may want to put their hands on them. They're not supposed to in this model. So I think that there is some areas that we can do better in the state to make it a little less obtrusive there and more therapeutic for the child.
Okay, thank you. Your presentation was excellent. It was the right amount of time, and I wish everyone had as good as yours was that we listened to, because it was very efficient, and efficacy we're all about around here. Representative Fleming.
Thank you, Mr. Chairman. I just want to ask you a quick question. You said about the percentage increases, and that's great, and that's a pretty powerful number. Could you translate that to dollars? Because if you go through and increase, what does that mean to the budget in terms of all that stuff? Because not only in your profession, but we're also looking at other professions in terms of mental health, in terms of nurses or whatever. So if we're going to look at dealing with the Medicaid reimbursement, we got to look at the whole spectrum and then see where the priority is. So what does that mean in dollars?
Okay. So I'm going to answer this question to the best of my knowledge based on the information I have received, but knowing that I don't know how much the federal dollar is contributing to the state dollar, so I'm going to tell you the large amount of number, and then that would really I think you'd have to do a cost analysis to see, like, is that 90% from the federal match or what the match is. I can't tell you the match because that's out of my limit. But for First Steps, if you did a 20% increase, you're looking about a $3 million statewide based on the services they provide. $3 million. for all providers. That would be the increased amount. Now, a lot of that fund would come from federal. So that would be my guess there. It would be around 3. EPSDT is less than $1 million statewide. It's around 600 and something thousand. That would be the increase total. Again, some of those funds would be federal matched. So I'm not for sure exactly what the state would, based on the budget. I don't know how all of that works, but total price, those are the two numbers. Now, for the flat Medicaid, the 5 CPT codes that we talked about, I do not know that number because I wasn't able to pull any data from exact how many CPT codes for 9257 whatever were used last year. So I did ask for some of that data, but did not receive that. So I'm not able to give you on the flat 5 CPT codes, but the others, First Steps, around 3 million, I'm guesstimating, based on how many children they served at the $89 times 20%. So if you take every child gets 18 visits every 6 months times 2, that's how I did the math on that. I don't know if that helps you any, but overall, when you're, it's less than, for EPSDT and First Steps increase would be less than 4 million.
No, and I appreciate you going through the exercise in terms of the calculations and formulas, because I'm very, very familiar with that. What I think, Mr. Chairman, I'd love to see, or at least make a request to the LRC, and we can talk offline, to get a general idea of what that means in dollars across the board, regards to the health provider, that we look at what we're dealing with Medicaid reimbursements, because I don't think that's done, and we need to get a better idea, because I'm hearing it now from her, but I have this workforce initiative going on, and we've got that's only one equation. The other equation is this reimbursement, because it affects your pipeline in terms of getting therapists in there,
right,
from a not only from a salary standpoint, but also from an environment standpoint in doing that. So, but thank you, I appreciate it.
Yeah,
It's a very good point. Thank you. Representative Bowling?
Yeah, and just another point, Representative Fleming's exactly right, looking at the whole picture and, what it costs, because, you have to budget for the entire program, obviously. Yeah. And that's why I think it is important that we look at the MCOs some more, because, I understand today you've asked for like a 20% raise or 20% increase. But if we can reform the MCOs and more of the current dollars are actually going to the providers instead of the MCOs keeping that, if there's a way to put guardrails in where providers at the current levels, it may not be the 20%. Maybe it is. Maybe that's what's needed. But it might not be. And that's just things that we've got to look at across the spectrum. Thank you.
I would like to add, I know that we're not, that we're supposed to be able to negotiate rates with MCOs, but they are notorious about telling providers that it's the 97% of the Medicaid fee schedule or 100% of the Medicaid fee schedule. We have a hard time as providers to negotiate those rates. And that's where we're asking at the state level to do an increase, because then we can go back to the MCOs and say, if you're telling me it's 100% at the, even though they're not supposed to do that, I'm going on record to say that they do that.
I feel your pain.
Representative Dr. Wilner.
Thank you, Representative Chairman Dr. Bentley. I agree with what my colleagues are saying, that we need to look at the whole picture, but I also want to say how important early intervention is, and the research is so robust on that, and what we don't pay on the front end, we end up with that multiplier effect and paying much more in all kinds of ways on the back end of that, and that can be hard to calculate, but I think that that's a variable that we need to look at too. We're not just talking apples when we're talking early intervention versus more complex issues down the road.
Yes. So. Thank you. And if there is any funding available, we're asking that this is an emergency issue that needs to happen sooner than a rate study can provide.
Once the providers leave, it's not that easy to get them back. Right.
That's right.
Any other questions? Renee, you did an excellent presentation, and all of us up here realize that our most important natural resource in Kentucky is our children, or we wouldn't be serving here, and appreciate your presentation. thank Secretary Glisson for coming. I recognize her because she worked hard for children when she was secretary. And before we adjourn, members, please know we'll meet next week, February 15th. We're going to try to have a meeting every week for this committee. And in the future, we'll be discussing a new lab for Kentucky. So we'll be the first to present it, so I hope that everyone's here. So thank you. Now, the next